All right, as people are joining us, I'll just do the introduction so we can get to the content, which is why all of you are here. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I'm just serving the role of convening public health, as well as you today to answer some questions. And this is a special session that we've actually added to the agenda because we've gotten a lot of questions from gyms and fitness facilities. So they're going to present specifically to you as the audience today at Boulder County Public Health, and then be available to answer some questions and hear feedback, just like the email said. So today we're joined by 4 people, actually. We're joined, first off, I'm gonna hand it over to Tessa Hale with Boulder County. And then we'll be sharing a presentation in just a few minutes, but Tessa is gonna kind of talk to you a little bit about the purpose of today's session and who we have joining us today. Take it away, Tessa.
Great. Thanks, Corinne. Thanks very much for setting this up. As Corinne mentioned, we wanted to have a special session with gyms and fitness facilities to talk about the new masking mandate and the fully vaccinated passport program. The fully vaccinated facility program, because we know there's a lot of questions and a lot of concerns, and we know how severely impacted your businesses have been through COVID. And so we wanted to just have an opportunity to share with you what we're doing and get some, just have most of the time spent for a Q&A and to provide some support. We also have Trina Ruland and Kate Haywood from our county attorney's office to answer some questions, and Dr. Chris Urbina, who's our chief medical officer, who's going to be able to just share a little bit about the latest statistics of what's happening in the county and sort of the rationale for why we had to move into this masking mandate. And so it looks like the slides are getting pulled up, and I'll let Dr. Urbina take it away.
Thank you, everyone. And I thank you for allowing us to come and speak with you today. I think you're such an important part of our community, the business community. I really appreciate Corinne inviting us to participate. What we'd like to do is share a little bit of data with you, but mostly answer your questions about I always get the name wrong. Help me, Tessa, with our
right now we're calling it is the fully vaccinated facility program.
That's what I meant to say, the fully vaccinated facility program. So I'd just like to share with you, we're not out of the woods just yet. And we try to watch cases very closely, and you can see since June, we've been having a slow rise in the number of cases in Boulder, despite our vaccination rates. We've done a very good job of vaccines in Boulder, most age groups, but we're still seeing a rise in our number of cases, largely due to the Delta variant. Next slide. This is our biggest concern, and I recognize not everyone looks at these dials in the same way, but if you look at our hospital resource status, and if I could just give you a big picture kind of thing, we obviously want to prevent disease, prevent hospitalizations and death, but as we start to see a number of cases rise, we generally see a 2 to 3 week lag in hospital beds. And in the Boulder County, we're at a critical level where we have, in terms of our total beds of 130, we really only have 16 ICU beds. So we're really struggling to meet that criteria. And if you look at our med-surg beds in general, our hospitals are really close to being over capacity. It's important to share these slides because I think you can understand why we're pushing very hard on trying to control this very serious virus. Next slide. So Trina, did you want me to present these or did you want to?
I can present them for you if you'd like. I think that one of the questions that has come up a lot from the fitness facilities, Dr. Urbina, is what is the significance of this hospital capacity, not just for COVID patients, but for all of us?
Great question. Thank you for pointing that out. I think what I forget sometimes is that even though I'm a family doc and I've been a family physician for almost 40 years now, that if our beds are filled with COVID patients and the ICU beds capacity is at that borderline edge, everybody else can't get into the hospital. So that if you have a motor vehicle accident let's say you have a heart attack or a stroke, or even elective surgery. And this is where we were last fall and winter. As that capacity for intensive care beds and critical care beds is over capacity, we're not able to actually provide healthcare in our community. And I thank you for pointing that out, Trina. I just sometimes don't quite communicate all of that because our hospitalists are struggling to keep patients out of the hospital. Of course, the best way we know how to do that is to implement vaccinations in our community. We've done a fairly good job. Now we're also talking about universal mask ordering in Boulder County. So we're really at that precipice of saying, how can we not overwhelm our system so we can keep our healthcare system alive in our community? Thanks for pointing that out, Trina.
I mean, before we move on to Trina, we actually have 2 questions in that we should probably answer now before we move into the fully vaccinated facilities. And that is, somebody asked, what's the percent of Boulder County ICU beds that are COVID patients? Or is it the overall number? Is that the number that you track, or is it overall ICU beds? And do you have the number of percent that are, going towards COVID patients?
I would say that largely, I don't have that number right at my fingertips, but we can get back to you on that. But I would say largely those critical care beds and ICU beds are filled with patients that are very sick from COVID. Now that varies on the day and it varies on the hospital, but I think that the majority of them are very sick from COVID-19. Now, that doesn't mean that all of them are. We can get that number back to you after this session.
And I'll post in the chat the data site where people can track some of these numbers. Another question came up, and it actually has 2 parts. And I think, again, before we move on to Trina, have special considerations of different industries been evaluated to show the risk for different types of businesses? Specifically, we have fitness facilities and gyms on. How many outbreaks have been in fitness facilities versus restaurants? Has there been just general consideration of different industries and the risk factors within those industries?
Sure, that's a great question. I'll try to tackle that one. There have been lots of studies regarding that, and Trina and I shared some studies prior to this meeting a couple of days ago. Is that obviously in a school setting, the risk is if you're not fully vaccinated, the school setting might be more difficult to stop the spread of infection. So that's why we have the universal mask order in school settings, because there are a large number of population of kids that are unvaccinated or not vaccine eligible. Other businesses, obviously, the closer you are to each other, like a theater or a stadium, obviously we try to put different practices in place, specifically around gyms. All of you know that while you're working out, you have significant exercise and respiratory breathing. I mean, obviously, I work out as well. I'm not, but I always wear my mask when I'm in the gym. And there have been studies that say that the risk of COVID infection is 2 to 3 times greater in a gym than it is in a restaurant. Now, remember, in a restaurant, we're still requiring people to wear masks as they walk into the facility and walk out of the facility and go into the restroom, those kinds of things. But while they're eating, they may take off their mask. And so that's the difference in terms of how we look at risk associated with spreading the COVID vaccine, the COVID virus, because as you know, the virus is not only spread by droplets, but aerosolized. So I think I'm trying to answer your question, but I think you hit it on a very essential question. There is a difference between businesses in terms of its transmission. Trina, anything?
So the indoor mask order was a way to kind of go cross industry, cross age groups, cross different situations to try to mitigate it from, those first couple steps: stay vaccinated, clean the facility, wear a mask. So you took into consideration all of those different, scenarios when you developed the mask order, correct?
Absolutely. And I don't know, Trina, if you want to add anything to that as well.
Yeah, I think you said it well. I have heard frustrations from gyms. Why can someone sit down at a restaurant and take off a mask? versus going into a gym and take off a mask. And just like you said, Dr. Urbina, it is a difference of risk. If you hold all of the other metrics equal, you keep everything equal, just because of the heavy breathing, the risk in a gym is 3 times higher. Plus you physically can't eat with a mask on, whereas you can exercise with a mask on. I exercise myself at a gym with my mask. I definitely hear the frustration. I also see questions about documented outbreaks in any Boulder County gyms. I'd have to go look at our data resources for that. All of the outbreaks within the state are published on the state's website. Anyone can go look it up. I will put the link in the chat as soon as I get a moment to do that.
Thanks, Trina. And in some, I've heard on some of the previous webinars, some of the outbreaks are really hard sometimes for the epidemiologists to trace back to the exact location of where they were able to, where they came in contact with the disease. We have a lot of questions coming in, so I'm going to let you present, Trina, and then we'll come back to these questions because we have, can we take this into consideration? Can we take this into consideration? We'll come back to it. Let's let you present on the fully vaccinated facilities, because this might actually answer some of those questions and some of the options available to gyms and fitness facilities. And then we'll come back to the questions if they're not answered.
That sounds great. So I'm going to speak about the fully vaccinated facilities and events program within Boulder County. As you all know, we have a mask order in effect right now. That's Public Health Order 2021-08, which requires everyone age 2 and older in all public indoor spaces, and that would include gyms, recreation centers, fitness facilities, basically anywhere that's not your house. You must wear a mask. And there are some exemptions if you're under age 2 or you cannot medically tolerate. And there are those exceptions that I know that has led to some frustration with this industry group. And those exceptions are for activities that cannot be done with a mask. They physically cannot be done with a mask safely. There is a third exception that we've added to this order, and that is if you're within an approved fully vaccinated facility or event, and that's what I'm going to talk about, because that third exception is available to gyms and fitness facilities, and I think it's an important one. The fully vaccinated facilities and events, this exception that I'm referring to, it's a voluntary program. You can choose to do it, you can choose not to do it. If you choose to do it, you can, and you are approved by Boulder County Public Health, then you can allow all of your members and folks entering your indoor space to remove their masks. If you choose not to do it, then during periods of substantial and high transmission, we are in high transmission right now, everyone within the facility must wear a mask pursuant to that public health order. You guys are actually getting an early preview to this. I haven't presented this PowerPoint slide yet. It will be presented tomorrow and later this week to all industries. So I just want you to be aware of that. I don't think our website is actually updated yet. And Corinne's shaking her head no. That should be coming any moment now with all of the detailed information. So this preview is actually ahead of that detailed information. So what am I talking about when I'm talking about a fully vaccinated facility or event? It has 3 very basic requirements to apply to this program. You must implement a written policy, and I am aware of some businesses, including some gyms and facilities that have already done this. You just have to have a written policy that says that your facility or event requests proof of full vaccinations for everyone entering your indoor space. And then the second requirement is that you have to have 95% of your people within your indoor space vaccinated. And I'll talk a little bit more about what that means in a minute. And then the third is not so much a requirement, but just some considerations for you. There's nothing required in the additional mitigation strategies, but we all want everyone to be safe, and recognizing that up to 5% of your indoor space could be unvaccinated. It's always good to consider additional mitigation strategies, your airflow, your ventilation, whether or not you ask for symptom screening, whether or not you enforce distancing within your space. Those are all considerations that we want businesses to think about to help minimize the risk, particularly if they're participating in this program. So back to that first component, that written policy. What the order requires is that you just have a written policy that requests proof of full vaccination for every single person entering your space. And there's been a lot of questions. Well, can I give someone an exemption or an exception? What if they're under age 12? The answer to all of the above is yes, but you get up to 5% of the people in your facility get that exemption or exception. And how you dole those out is completely up to you. If you want to say every single person over 12 has to show their proof of vaccination, period, and you've run that by your lawyer, then that can be your policy. If you decide that you're just going to admit up to 5% and that's going to only be in one form or another, you can do it that way. I can't give you legal advice. I am an attorney, but I can't give you legal advice. I just want to emphasize that. So it's important that you go and talk to your legal counsel in developing these policies. And Corinne is putting together a wonderful presentation for Thursday where we're actually bringing in an outside counsel to help present on these issues and help guide businesses in developing their policies and identifying considerations for them. I know it's tricky, but we're hoping to get you the resources for that. And then Boulder County Public Health also recommends that if you have a written policy, which you do need for this program, that you address the actions that your facility or event will take in the case that someone walks in and refuses to comply. Either they refuse to show you their proof of vaccination or they refuse to show you the documentation that you're requesting to be in an exemption. The second component, the second thing you have to show to be part of this program is that 95% of your facility or event actually is vaccinated. How you use that 5%, like I said, is up to you, but you have to count every single person in the indoor space. You have to count people with medical reasons, keep people under age 12, people who might need a disability accommodations, or any other person who's just refusing to show valid proof of full vaccination. And then the third component are these recommended mitigation strategies. Like I said, all recommended, none required, but we want folks to be as mindful about these things as possible. We also recognize every space is different, so this might look different for different facilities. And this is just a list of recommended mitigation strategies that we know work: the airflow and ventilation, increased distancing, limiting your capacity if that's appropriate. You could also have your unvaccinated individuals wear masks if that is appropriate for your facility. Folks have asked, well, how do I know that someone's vaccinated? And the order actually has the ways that you can show proof of vaccination. And there's really a couple ways, but they all come down to the vaccine card. Someone can show you their original paper copy. They can show you a copy of the copy. They can show you a photo on their phone, or they can log into the My Colorado app, which is a digital form of identification sponsored by the state of Colorado. It links to your vaccine record. And there's an image on the PowerPoint, and that is an example of the My Colorado app, and those are all acceptable forms of proof of vaccination. There's also, if you are admitted into the program and approved as a fully vaccinated facility, a signage requirement. The sign here just says proof of vaccination required. That's what the program is. And if you show your proof of vaccination and you have that 95%, then folks in your facility don't have to mask. So the sign also notes that as well. Here's just a note on eligible facilities and events. And as I mentioned, gyms and fitness facilities and recreation facilities are absolutely eligible for this. But something I want to emphasize and point out is that we recognize that a fully vaccinated status might not be appropriate for every indoor space at all times. So this program is flexible. If you want to offer a class time that is a fully vaccinated class time, you can ask for proof of vaccination and have your written policy for that time of day and operate that class as a fully vaccinated class. And at other times of day, everyone just has to wear a mask regardless of vaccination status. If you're a facility that has multiple rooms, you could designate one of your rooms as a fully vaccinated room and require the proof of vaccination with your written policy and your 95% rule for just that room. And when folks go into that room, and once they've satisfied the requirements of your policy, then they can remove their masks in that room. Just some other notes about this. I just want to emphasize again, there's no outdoor requirements. So if you're a gym and you have an outdoor space and an indoor space, you can treat those a bit differently. You can say, look, we're going to require proof of vaccination for stepping inside, but if you want to work out outdoors, we're not going to ask. There's also a request from Boulder County Public Health to please honor individual decisions to continue to mask. If you have someone, and even if you're a fully vaccinated facility that comes in and still wants to wear your mask, we ask that you just honor that. You don't require people not to mask. And then just a note that, there are federal orders and state orders out there. And if the state suddenly institutes a mask order, we're going to have to follow that. Likewise, if there's a federal law that you have to follow, you'll have to follow that as well. I know this question has come up already before we started messaging, but as you all know, or maybe don't know yet, our mask order relies on the CDC's transmission tracker. And the CDC identifies 4 levels of transmission in a community: low, moderate, substantial, and high. Following the CDC's recommendation, which says that if your community is in substantial or high transmission, everyone should mask regardless of vaccination status. That's what our order requires. So when we're in substantial or high, masks on. And if you're a fully vaccinated facility, you can only get out of that if you're following your policy and you're meeting your 95% rule. If and when we drop into low or moderate transmission, the mask order goes away. And if you are a fully vaccinated facility, you will no longer be required to follow your proof of vaccination requirements, although we would recommend it. If we were to then go back into substantial or high transmission, we would not require reapplication. You could just go ahead and start implementing your written policy again, following your 95% rule, and you'd be back to where you were before we dropped down again. And I bring this up because this is our historical graph. We see waves, ebbs and flows. Right now, we're currently in our 5th wave. If you look at the seasonality of this, last year we saw a wave in the early fall, followed by a drop, and then a more substantial wave in the winter again. So we just want folks to be prepared for that. When we plot our historical mask requirements over last year, we saw that a mask requirement would have gone into effect around August, and it would have remained in effect until about mid-June. And here's some links to some more information. Like I said, the website has not quite yet been updated because you guys are getting an early preview. But once it's updated, all of this information will be up there. Dr. Urbina has a question.
Dr. Urbina, you're on mute.
I just want to make a comment after you were done.
I'm done.
So I wanted to highlight a couple of things. The whole idea, we know that vaccination is not 100%. We know that. We know that masking is not 100%. And that's why the emphasis on multiple layers of protection. We're trying to reduce risk both indoors and outdoors. Obviously, the risk is less outdoors because we're physically distanced from folks. But once we get indoors, then all the questions I see in the chat are about if we have increased space, if we have ventilation, if we're washing our hands, if we're doing all those protections, all of those protections are perfect. We really want to encourage that, whether or not you're a fully vaccinated facility or event, or you're fully vaccinated, because we know that vaccines are not 100%. So this is a way of voluntarily saying to you that you can make it work for your facility and your clients in your gym and your community, because these are the recommendations, the science that says that how to protect yourself. And so I just wanted to emphasize that you can do this, we can do it together, and we can protect our clients, our community by doing these following strategies. So thanks for letting me say that.
Well, thank you, Trina, and thank you, Dr. Urbina. I'm going to ask a couple questions. Do you have more present? I'm going to ask a couple of questions, and then we'll come back if you have more to present. I did put the website link in for the new fully vaccinated facilities. It is live, so Tessa has shared that. I did put the outbreak link for the state outbreak site, so you can track the outbreaks across the state. And then I did put the link into the chat for the data, so you can track the data in Boulder County yourself if you'd like. So Dr. Urbina, can we start with you? Someone asked specifically you if you can touch on antibodies developed for previous exposure to COVID and how that compares to the vaccine.
Great question. I just looked at this data this morning, and it's unclear. our solutions to natural immunity versus vaccine immunity are still, we don't have the exact answer. It looks like if you have a severe infection, that your immunity is going to last longer because your immune system is strong, it mounted a very strong response. So we now think that might be as long as 6 to 9 months, and you might produce antibodies and those may stay in your system to protect you. Vaccines are about the same. We right now think that for the majority of people who are immunocompetent, that is, they have a healthy immune system, that vaccine protection probably lasts for 6 to 9 months as well. But if you have a chronic medical condition like diabetes or lung disease or heart disease, or if you had a recent transplant, kidney transplant, or were on steroids, that your immunity is not as strong, and that vaccine protection probably wanes a lot quicker. And that's why some of the discussion around vaccine, third doses of the vaccine and boosters are happening right now, because as you get older or you have a chronic immune system, chronic medical condition or a depressed immune system, your vaccine immunity will taper off. So I wish I had an exact answer for you, but that's kind of what the current research is regarding natural immunity versus vaccine immunity. And in fact, if you add the two together, if you've had the previous infection, you get vaccinated, you can boost your immune system even greater, and that immune protection will actually last a little bit longer.
I'm going to stay on you for a minute. So a lot of the conversation that's happening on why we remasked and the outbreaks across the country are talking about how you can still get COVID even when you're vaccinated. And you can still spread it. So can you explain the philosophy behind the fully vaccinated facility program, knowing that you can still get and spread COVID when you're vaccinated?
So great question. Thanks for the question. We know that when you achieve community immunity, that is for any infection, like let's take, for example, measles. If we have 95% of the population vaccinated against measles, we can essentially eliminate measles in our community. And that's actually what we've done in the United States. So we're thinking that likely if we can get that vaccination level up to a certain high level, we can actually have the virus no place to spread. So if people are in this voluntary vaccine program and you can get your facility up to 95%, and then you mask, in addition to that, you do all the ventilation, you do hand washing, you do the distancing among events, so you can actually protect your community within your facilities. And that's some of the thinking behind it. Not knowing fully that no one individual intervention or mitigation factor is perfect. Adding them all together actually adds protection.
All right, so Trina, you mentioned the mask order. I think there was a little confusion when we moved to the fully vaccinated facilities site. So first, I'm gonna go back to a detail around the mask order. You said when we enter the moderate or low or yellow and below, that the mask order goes away. But that in the order, it does say after 21 days of consistently in that level, correct?
That is correct. And thank you. I should have added we need to be 21 days in low or moderate transmission. And that's really to stop this rubber band effect. We don't want to snap back and forth between mask, no mask. And we went and historically plotted the data to look at what would have happened if we applied this metric in the past, and it was a good result. And we're confident that if we're 21 days and low or moderate, then it's probably a consistent trend.
Okay. So the mask mandate is the Boulder County order. That is required by all businesses, all gyms, all restaurants, all office, all manufacturing, all auto body shops, all, anybody that has an indoor facility has to have the mask order. The fully vaccinated facility is an optional program, correct?
Yes.
And have you seen, I know you've worked with quite a few gyms and fitness facilities, especially Tessa and Trina lately, talking about how this might be well designed for some of our smaller and even larger gyms because they're membership based and can keep track of this information. I think we have a lot of people on here saying that the mask order is disproportionately biased against gyms because it's they've had a really tough year, really tough winter. People can, are still going to grocery shop when they're wearing a mask. They're still going to go to work or work from home. But gyms may be that one thing that they opt out of now that they have to wear a mask. Just reading some of these. But how can this program help gyms, and in what ways are gyms better suited than restaurants even to maybe do a fully vaccinated facilities program?
Tessa, you want to answer that?
Sure. Well, Corinne, I think you answered it in part because gyms have memberships. So there's, in terms of tracking and being able to know who is fully vaccinated and have that information, that's one way. I think what we've seen and heard from some of the facilities in town that have early adopted the fully vaccinated program, that they've actually had people who were really happy to hear it and happy to come work out and not have to wear a mask. So that's actually been a benefit. I understand that there are some people who don't want to be vaccinated and want to, go to another gym where this is not required. I think that what we're seeing is that we've heard feedback from both sides, right? And we know too, I know that I saw some questions in the chat around distancing and other mitigation strategies for being in these large spaces with low capacity. And that is something that will be taken into consideration. I just want to say, we will be looking at an individual basis for gyms specifically at mitigation strategies. That is not something that we're doing for restaurants or other facilities. And so we do want to support people and being able to stay in business and keep things going. Our ultimate goal with this is to lower the transmission rate and then to get back to normal. I mean, that's what Dr. Urbina was saying, is our whole goal is if we can stick this out for a little bit and then get back to business as usual, that's our ultimate hope. And I don't know, Corinne, if there was something else specifically in there that
No,
and
I just want to ask a follow-up question, which is around, sorry, it just blinked on me. It was a follow-up question just around clarification. I think this is news to a bunch of these facilities, that it doesn't have to be a 24/7, 24/7 exception, that you can choose this yoga class or this Pilates class or this room as your fully vaccinated part of your facility and can be part of the application. So could we re-clarify that? I have a bunch of questions. Are you saying that I could have a class with no under 12-year-olds and that could be my fully vaccinated class? So could you again re-clarify the ways that they could model this specifically for gyms or fitness facilities?
Yes, thank you. We absolutely want this to be as flexible as possible in that regard. And so, as Corinne was just stating, you could have certain hours of the day that are fully vaccinated and the rest of the time is masked. You could have different parts of different rooms in your facility be fully vaccinated and unmasked, or you could have certain classes. And with the signage that we're providing, there's a sign that's fully vaccinated facility, which indicates that at all times it's a fully vaccinated facility. And then there's another sign that is fully vaccinated at designated times. And then you can determine that and share with your clientele, these are the times, these are the classes, these are the hours.
But when it's not the fully vaccinated facility, when you can't guarantee that at least 95% of the people in that room or building, depending on which area you've designated as fully vaccinated, everybody has to mask. It's not an either or situation. It's everybody has to mask during the when it's not above the 95% threshold.
Yes, thank you for that clarification. It is not an either or.
Okay, so knowing that these applications are going live later this week and that the website is now up to date with the information, how long will it take to get approved once they apply?
We are prioritizing the facilities. There's about 130 facilities in Boulder that had already had this in place. So we'll be prioritizing those. And then we're expecting to take up to 10 to 14 days to turn around others. We're going to work as fast as we can. We don't know how many people will be applying, but we're working we've got a plan to turn this around as quickly as possible.
And that's one of the reasons we're providing the information throughout the week. And also I'll be sending out an email with all the information to the listservs that I have, all the local chambers and economic development, the municipalities. And then we're going to have another webinar on Thursday. So after you digest it, you can ask your questions, and then we will have that legal counsel on there on Thursday. So I did want to point out that we're releasing the information beforehand so you have time to prepare. So another question that comes up is, so I'm going to go back to you, Dr. Urbina, because we have some really long questions for you, but I'm going to ask why, if you're saying natural immunity compared to vaccine immunity is similar time, the immunity time, why isn't a naturally somebody who's had COVID and maybe in that natural immunity time frame being considered under this fully vaccinated facility program?
That's a great question. The science is evolving. I wish I had that answer. How do I determine whether or not somebody is fully protected from natural immunity? Those antibodies that we talk about in terms of testing, those are not everybody keeps and maintains those levels of antibodies in their system. So it's difficult for me to assess whether or not somebody has that protection from a previous infection, because if you have a mild infection, your natural immunity is shortened. If you have a very severe, and this is what the data says now, and that could be changing in the future. If you have a very severe infection, your natural immunity lasts longer. So it's very difficult to measure that natural immunity and how long it lasts. I wish we had an easy answer to that we can say, do this blood test, and we know how long if your natural immunity is still protective. We do know that for vaccines, because we have those long clinical trials that we've been using all those folks and watching them for almost full 2 years. So we know how long that lasts. Hopefully in the future, we'll have more information so we can really answer this question better. But at this point, we don't have an easy answer for you.
Okay, some technicality questions for Trina, Tessa, Kate. So the first one being, we have some gyms on here that were 5-star certified. So we know they were doing a lot of additional mitigation efforts above and beyond in the first round. They were inspected in some cases. One particular gym was inspected 3 times. Now, 5-star doesn't automatically allow them into this program, but those additional mitigation efforts would be considered in that third key point that Trina brought up around distancing and some of the protocols you have in place and some of the things that you've already done to show your commitment to public health, correct?
Yes. So having been a part of the 5-star program sets you up really well in terms of this application process, because you've already implemented a lot of those mitigation pieces Corinne was just talking about, and it'll be easier to complete this application through that. And those strategies we will take those into account when we're taking a deeper look at your facility.
Okay. And let's say your max capacity is 700 people, but at no point are you really bringing in more than 30 or 40 people. It's not 95% it's 95% of the people that are in the facility at that time, correct? That's
correct. The 95% is for who is in the indoor space at that real time.
So it may be, if a good portion of your membership is vaccinated, it may be to your benefit to do so, especially since you have those distancing strategies in a rather large facility. We have a lot of questions like, I have, 60,000 square feet, and so people can distance really well. Well, that's going to be a key focus for that application as well.
Yes.
Can you explain youth activities? It said that one of the areas that doesn't apply are youth activities. So what about those gyms, fitness facilities, rec centers, all of those that have youth classes or youth programs? How might they operate under this program?
So that's a really great spot where you can take advantage of the flexibility of this program. With children under 12 not having the vaccine available to them, class full of under 12-year-olds is not going to qualify, nor is it eligible. But if you have certain times of day where, when children are in school or otherwise, you can host those as your fully vaccinated hours and then require masks for everyone during other hours. Alternatively, you can always break out your rooms and designate certain rooms as fully vaccinated rooms and other rooms as for everybody.
So the idea would probably be I've heard the opposite, where businesses have come to me and say, could I just do an unvaccinated room? Well, that doesn't work, because when that person leaves, then everybody needs to put on their mask. But you could have common areas with masks and then those fully vaccinated rooms where it's nobody under 12 anyways, or you're able to better monitor that room for the vaccination status. How are you enforcing this? Just on the mask mandate, there's people asking about the enforcement of the mask mandate, because we have seen some businesses not understanding it, not following it. How is that being enforced, and how will you enforce the fully vaccinated facility? Kate?
Hi, Corinne. Yes, I can speak to the enforcement piece of this. Thank you. So with respect to enforcement, public health's primary focus, first and foremost, is education. So as we receive reports from the community regarding businesses, we will, first thing, try to contact you, likely by phone, maybe by email or swinging by, just to talk about the order, make sure that your business understands the order and what you need to be doing, and the basis for the complaints that we've received. That usually does the trick in bringing the facility into compliance. If we continue to receive complaints despite education and outreach having been conducted, we may take that next step of issuing written notices of violation, sort of putting you on notice that, yes, you are committing a violation and we need you to come into compliance. If, we continue to work with your business, we see those good faith efforts, we'll continue to work with you to help you in your efforts to comply. If we determine that there is a willful violation, that there is no good faith intent to comply, then we do have the option to file a civil suit against a business. And what we do in those civil cases is we start by asking the court to grant us injunctive relief, basically a restraining order against the business that prohibits the business from violating the public health order. And then once we have that court order in place that says, hey, business, you need to comply, if there continue to be violations of not only the public health order, but then the court order at that point, then we can go to court and seek civil sanctions for the violation. And that's pretty much how it tracks. In the past, we've gone to court. We've only had to take 4 businesses to court in the past, and we've been successful in each one of those actions.
Thanks, Kate. That's pretty, that's pretty good detail of the enforcement capabilities. What I've seen is that first step, that education phase, is often the key component. In a lot of cases, I get a lot of emails saying, I don't think this facility is doing it right, or this one. It was around confusion. It was, I thought the order was an either or I thought this. So working with them to better understand the order is often the first. And I appreciate that that's the first step, that you're not going to court as the first step, and that you're taking a good bit of time to answer questions, to do these types of programs, and to answer questions when they email in. How long would the fully vaccinated facility, last? Would they be re-inspected? How long is the fully vaccinated facilities program going to last?
It's for the duration of the mask order. So as long as the mask order is in effect, the fully vaccinated facilities program will be in effect. And as I mentioned, if we dip down into low or moderate, and then we dipped back up, your approval would be honored if we go back into that high transmission.
Okay. So if they've already done the temporary exception where they did the attestation online, do they have to reapply?
Yes, that expires on September 30th. And so everyone would need to reapply. We are prioritizing review of places that did already do the self-attestation and were approved.
So this answers the other question where people were like, well, if this isn't even available till the 24th, how did other businesses apply? Which is that if you as of September 3rd, we're already, I know a bunch of fitness studios, the smaller studios that were already implementing vaccine policies that you couldn't enter without vaccine. You were allowing businesses that were already operating at that time to say they were and to have that 1 month grace period until this program was launched, correct?
Yes.
Okay, fully vaccinated, is that 2 weeks after your second shot, or has that been redefined with the booster?
No, great question. Thanks for asking it. It's 2 weeks after your fully vaccination. Now, with the booster, remember, that it just adds extra immunity, basically. So it's really after those first 2 doses. Now, booster is going to help you, but it doesn't disqualify you if it's after. It's still after those first 2 doses.
And just to, so Tessa, this seems, one of the questions is, this seems very difficult to manage for larger facilities. You know, some of our smaller, the class of 15 people or smaller facility that we have. But some of these larger facilities, they're wondering if you have any recommendations or tips on how to make this work, how to keep track of the 95% at any given time. You know, that's one of the difficulties for some of the larger facilities.
That's a great question. And I saw in the chat someone had suggested MindBody already does the tracking for you. I think if, and I'm assuming that people on this call are going to have better suggestions than I would in terms of what software or apps you could use. But I think the key thing is if you implement classes or times that are fully vaccinated and you know that the people on record coming in, you know, if you're monitoring people as they're coming in and you have something that marks whether they're vaccinated or not, then you would just be checking in how many people have come in that are fully vaccinated, or you just set aside those classes and spaces that are for fully vaccinated people only.
Okay, so there's clarification needed on that 95% again. So if they have a class, let's just make this easy and say they have a class of 20 people and 1 person is unvaccinated, then the whole class can go maskless.
Yes.
But if they have 2 people that are unvaccinated in that class, which now makes it, I think, under the 95%, then everybody has to wear their mask in that class, not just those 2 people that are unvaccinated, correct?
Yes. And just to be clear, it's not a requirement that the unvaccinated person would have to wear a mask when it's under that 95% threshold. It is recommended.
If they're under the 95% threshold, they're not actually a fully vaccinated facility at that point, and everybody has to wear a
Everybody would have
mask.
to wear a mask. Yes. If you're at if you're at 6%, then everyone has to wear a mask.
It's good reminder, Corinne, that a lot of people will still want to wear their masks. And so it's okay to wear a mask when you're in a facility. So that I think what we worry about is people are going to be stigmatized because they're wearing a mask. You know, we don't want that to happen. We want people to wear a mask indoors to protect them.
All right, and now I'm going to group a bunch of questions together, and these are around why is Boulder County the only county in the area that's doing the indoor mask mandate? And have you considered to make it easier on businesses requiring vaccine for all indoors, taking away the choice for businesses so they're not facing opposition from individuals? Those are 2 parts. So first part is, why is Boulder County the only one? Are other counties considering a mask mandate? And second part is, have you considered, you know, requiring a vaccine for all indoors? The choice is leaving business owners to face opposition to this whole movement.
Trina, are you available?
Sure. So the answer about other jurisdictions, Pitkin actually just implemented a mask order. We do talk to our neighbors. I just can't speak for them. I know that it's always under consideration, and the CDC does recommend masks for substantial and high transmission, and we need to preserve our healthcare capacity locally. For the second question of requiring proof of vaccination all indoors, I will pass that along up to the decision makers. I know that some jurisdictions are in fact doing that.
At this time, we have a mask mandate. We have this fully vaccinated facility program option for businesses so that they can, you know, relieve the mask mandate in their facility if they follow the protocols of this program. but there are no other capacity restrictions or social distancing or some of those other more restrictive measures in effect right now, correct?
That's correct. Part of the reason that Boulder County implemented this mask order is so that we can avoid those restrictive measures. We know that putting capacity restrictions on businesses can severely impact your businesses by limiting your space and the amount of people that can be in there. And we don't want to do that. And hopefully by putting this mask order in place early, we are avoiding that going into the winter. If you look at our case counts compared to our surrounding counties, we are doing better. And we are hopeful that because we have put in preventative measures early, we will not have to take more extreme preventative measures. And hopefully our neighbors don't have to do that, but we're watching the data.
Okay, so I think Dr. Urbina, I need you to clarify one more time why we're allowing fully vaccinated facilities to go maskless when there's still the potential of transmission in these rooms or these facilities, even when you're vaccinated. After you gave it like last time, I got a bunch more questions about it saying, then this doesn't make sense.
Sure. And again, I think we're trying to be reasonable. We know that nothing, whether or not it's a vaccine, a mask, ventilation, physical distancing, or any washing your hands, cleaning your surfaces, no individual is 100% perfect, but we know, or protective against infection, but we know by putting them all together, we can actually do the best job possible of preventing disease transmission. Our other goal, as Trina mentioned it several times, and I've talked about this as well, is protecting our healthcare system so that we can get people who actually need the healthcare system. And then the final one is the most important one, is that we want to avoid closing down businesses, lockdowns, doing all the things that we think are unreasonable to do if we can put all these mitigation things in place. And so I hear you. I think nothing is 100%. And yes, there will be transmission, but we're trying to minimize that and protect our healthcare system and try to stay as normal as we can. There are no guarantees in life, and I recognize that we're just trying to do the best job possible by working with all of you to try to keep businesses in place by creating extra strategies, working together to try to reduce the transmission.
I think the confusion is that there's the 95%, so you can have that 5% unvaccinated or unverified in the same room, maskless with people that are vaccinated. Can you talk a little, maybe not Dr. Urbina, but maybe Trina or Tessa or Kate, talk a little bit about why that 5% was put into place, why it was 95% and not 100%, and you're allowing unvaccinated and vaccinated to be maskless together?
Yeah, so this is a little different than San Francisco and New York's program, because the part of the goal of this program is, if you listen to the Board of Health meeting, to create systemic changes that will get us closer to community immunity. And part of that is asking our businesses to partner with us and help encourage vaccinations and get us back to normal through vaccinations. So the 95% is based on a number of things, as Dr. Urbina mentioned earlier, that is very close to community immunity that we saw for other diseases. It is also recognizing that there may be medical exemptions. It's recognizing that if you're an employer, you may be subject to Title VII and required to analyze medical and religious exemptions. And it's recognizing that the ADA might require reasonable accommodations for those who cannot get vaccinated. So that's really where the 95% comes from, both from the science side and from the legal side.
Okay. Once you've applied, do you have to wait until you get your verification and approval before you can start operating as a fully vaccinated facility, or to wait for an inspection? What's the process going to be?
Yes, you would wait to have a confirmation email from Boulder County Public Health that you've been approved, or we may contact you for more information if we're trying to take a deeper dive into your specific facility mitigation strategies.
So There's some conversations going on in here. Somebody did mention that MindBody does have a vaccine tracking tool on it now. So if you use one of a lot of the programs, whether it's HR programs or some of the customer membership-based programs, are adding this portal to it. So you might want to check with your vendor that you're using, because it might be something that's in the works already. We're noticing that with HR, especially with other states implementing vaccine passports across the country. This leads to a question, which is Boulder County leadership considering proof of vaccination requirements for gyms permanent, like LA County and New York City?
I can never speculate to what the future will bring, but the fully vaccinated facility is tied to our public health order. So when we drop into low or moderate transmission, it hopefully goes away. And as the stated goals of leadership is, we want to return to normal. So that's really the end goal of all of this.
All right. So,
I have a
go ahead.
comment about that, Corinne. Obviously, you know, as we talked about with natural immunity and vaccine immunity, if we can get as many people vaccinated as possible and put together a mitigation, we can actually stop the virus from spreading. So we can get down to that low level of transmission and risk assessment that we're talking about. So that really, this is an incentive to get vaccinated. And so we're trying to encourage businesses to partner with us to actually try to make that happen. We're working with the schools, we're working with other industries to try to get people to get vaccinated. And that's really part of our goal in trying to reduce the transmission in our community.
Okay, so Tessa, just to clarify, is an inspection part of the application, or is it just a written application with the knowledge that they're open to public health coming into the facility?
Correct. So if you take a look at the web page that Corinne sent out, it goes into great detail about every element that we'll be taking a look at and for you to be developing your policy around if you choose to do so. And we will not be inspecting every facility. However, as Kate outlined, we are getting on a regular basis complaints from the community if they are somewhere and people are not following the masking mandate. So, and we're responding to that. We have staff that are following up on complaints made by the community. And Kate, I don't know if you want to add anything to that.
No, I think you covered it.
Okay. So so the webpage is live. When will the application be live that businesses can start applying?
On September 24th, there will be a button at the top of that web page where you can go online and you can complete your application.
Okay. Sorry, we're getting some of the same questions again. I'm gonna answer some of the other ones, and then we're gonna come back and re-clarify a few things. Can you talk a little bit about on the ICU hospital tracker? Does it track how many are Boulder County residents versus people from surrounding counties that are in Boulder County hospitals, and why? You know, what's the metro area hospital situation looking like?
I don't have that data right in front of me, but a hospital bed is a hospital bed. Whether or not the hospitals in Boulder County accept patients from the outside, that's fairly routine in terms of a sister relationship with other hospitals. So that whether or not they're residents of Boulder County or not, it doesn't track that. It doesn't say that. We can probably fine tune that question, but it's a hospital bed. Somebody's occupying.
And there's most likely a Boulder County residents in surrounding county hospitals, depending on their insurance or who their provider is, or, you know, so it goes both ways. So if there's people from outside the county in our hospital beds, there's also people from the county in other county hospital beds.
Right, and there's a statewide relationship between all the hospitals, so they share patients often depending on their capacity, staffing, et cetera. And we actually have a sister relationship with Wyoming and Nebraska as well.
So there's two parts to this question. So this is about, do you believe the mask order is going to de-incentivize individuals from getting vaccinated? And how have you taken that into account? And then the second piece to that was how can we provide more information to businesses about vaccines that they can share with their clients to try to help promote vaccines a little bit cleaner and inform smaller communities and reach communities that trust them as businesses.
Those are great questions. I think what we've seen from other vaccine passport type programs, both abroad and here in the US, is that it definitely encourages people to get vaccinated. People want to get back to living life without wearing a mask, and this is the quickest way for us to get there. So we see it as actually being a much quicker path to getting to lower transmission rates. What was the second part of the question?
I think it's probably feedback that we can that we could probably share information with. Is there information we can provide our members, clients
testing,
that would help
yes.
us share information regarding the vaccine and the benefits of it? May be good for the smaller communities, and especially those clients that trust their gyms, their fitness facilities, their car dealer, those types of businesses.
Yeah, that's a great idea. And our vaccination program has a lot of great information in all different languages with a great overview about the benefits of it and the safety of it that we can absolutely pass on to you, Corinne, to share.
Okay. So I'm going to read this question word for word, Dr. Urbina, because this question hasn't been addressed properly according to the asker. What is the difference between allowing vaccinated individuals to be maskless, fully vaxxed facility rules versus allowing maskless, fully vaccinated people being with masked, unvaccinated, unverified people in the facility? So this gets to the either or question. What's the difference between going maskless, where you have 5% potentially unvaccinated and people unmasked, versus that either or scenario, which is those people that are unvaccinated wear masks, but those that are not, those that are fully vaccinated do not wear masks?
It's a really a trick question, isn't it? We obviously want people to be vaccinated and wear masks in indoor settings. This is a compromise. This is a way of incentivizing folks to get vaccinated. If we increase that level of vaccinations, we decrease the amount of transmission. And I can't say it any better than that. Obviously, if we know that the population that is currently using in gyms and in restaurants, we have a large percentage of our population that is vaccinated, so that by adding a layer indoors of those folks that are vaccinated and non-vaccinated, it does protect you by adding a different layer of mitigation. Neither one is perfect, so we're trying to meet in the middle to try to return to more normal by providing this incentive. And I can't answer it any differently than that. I don't know if Tessa or Trina you can help us if I can say it differently. If there's a different way of saying it, I'd be welcome any suggestions that you have.
I appreciate you re-answering that one. I'm going to move on though, because we're running out of time, and I'd like to get a couple more things covered. So when you're talking about class sizes or facility size, you know, some of these facilities are really small, or some of these classes are really small. So you couldn't even have one person in a 10-person class be unvaccinated. You have to have maybe a minimum of 20 people in that class in order to have one person unvaccinated. So how do they deal with it in those situations? Is it just 100% vaccinated at that point? Because you can't have, you know, half a person.
Yeah, I mean, unfortunately, you know, in that scenario, then everyone would need to be masked up.
Unless they're 100% vaccinated.
Unless they're 100% vaccinated.
So we're getting a lot of feedback here. I'm going to download all the feedback and submit it to Boulder County Public Health around, you know, facility size, meeting in the middle, some of the feedback that they have about, you know, feeling this being unfair on gyms compared to some other industries. There's requests for, you know, whether there'll be money available to gyms, because it's been a tough COVID and it's going to be a tough winter, especially masks. So we'll make sure we get out the information on any financial resources that are going on, but we're also going to send out a feedback form for you to submit your needs as businesses to some some groups that are asking for that so that they can figure out how to allocate ARPA funding. So I'll send that out in an email. I'm just trying to look through some of the things that are coming in as feedback. Size, different types of classes. Just another piece of feedback that came in is that not all gyms and not all fitness studios are equal. Running on a treadmill doesn't always equal Pilates, the amount of exertion for some of these others. So they just wanted, a couple people pointed that out. Let me see if there's any other piece that we can ask that is. So I think there's a question about whether or not the vaccine requirements among Boulder hospitals is causing people to quit employment at these hospitals. Could you clarify whether or not this is just a local trend that there's a requirement for hospital workers to be vaccinated, or if this is more of a statewide and national trend?
Yes, Dr. Urbina, I wasn't sure if you were going to answer this one, but it is a statewide mandate for healthcare facilities, long-term care facilities. There's a list of mandatory vaccinations for some facilities.
That is correct. The challenge is that people were very fearful that people would leave and stop working or not. And I think we're experiencing that in only small numbers so far statewide, because people are figuring out that, well, in a healthcare setting, long-term care facility, assisted living, we're also trying to protect our patients there. So people are figuring out that the best way to do that is to get vaccinated, whether or not it's against rubella, measles, influenza. And those are mandates already in place for healthcare workers. And this is just one more that is going to try to protect not only them, but the patients as well.
All right, and then I think I'm going to end on this question. Again, if you provided these long feedback paragraphs, I wasn't able to get to them, but some of them were directed to Dr. Urbina or to Trina or to Tessa. I'm going to download all of the feedback that came in the Q&A in the chat and submit that today. But this last question would be about, if we are worried about hospitalizations and severe illness, why is the mask mandate following transmission? The CDC tracker, which isn't following those key metrics, but it's following transmissions and % positivity.
We're actually monitoring all of those variables. We're looking at transmission. We're looking at positivity. We're watching hospitalizations and death. All of those factors we're watching very closely. As folks know, not everybody, most people recover actually from COVID-19. And fortunately, not everybody is hospitalized. So we have to monitor all those things. And Trina said this well earlier, we're watching all of those things. So it's not just, the transmission is one of those factors, but we put into everything, we put in to the equation all of those variables.
But for the order, the CDC tracker, going down to moderate to low, which is in the yellow, follows two metrics, but you're also looking at the other metrics, and those often are precursors to hospitalizations and severe illness. If your transmission numbers are high or you have a high positivity rate, those we've heard for the last 18 months that those are often precursors to the other indicators going up. But for the order, it is the CDC tracker, which is the % positivity and the transmission rate per 100,000. That doesn't mean you're not tracking the other data points.
Yeah, and I'll just add something to that, because we've looked at this in a great amount of depth. Hospitalizations lag cases, and we know that. And now that we have the vaccines, we were wondering, oh, maybe hospitalizations will drop even more, even when you have higher cases, but that hasn't proven to be the case because of the Delta variant. And we've watched the data in other states, and if you look at Florida, there's actually more hospitalizations now than any other time during the pandemic. And this is a problem. And other states are now in crisis standards of care. And that's very concerning. That's what we don't want to happen here. And so we are tracking the cases because it is the first look at what's to come down the road.
Okay. All right. I'm going to, again, I'm unable to, because we're almost at 5:15. And at this point, we will have another webinar on Thursday at 1 o'clock. It will involve Trina, it will involve Lane, it'll involve a private attorney who can answer some of the policy, external and internal policy questions. Please take a look at the Fully Vaccinated Facility website. I'll send out the information as well, probably early morning or late tonight. But look at that, put some more questions together around, getting your application and if this is an option for you. I want to thank Kate, Tessa, Dr. Urbina, and Trina for making time today. We know that there's been a lot of feedback and a lot of questions among gym and fitness facilities. So we wanted to make sure to have a special dedicated time to that industry, to bring in Dr. Urbina, to have this opportunity, because sometimes we can't get into some of the industry specific questions when we're in the cross-industry support sessions. If we need another one in the future, as we've done in the past for other industries and this one, we will hold one. But in the meantime, continue to look at this information, continue to submit your questions. I want to thank you all for being here today, for outlining this program, for getting it up before the applications went live. I appreciate the little lead time on that. And I appreciate you being here to listen and to hear the suggestions, and hopefully we can, put some of those suggestions into action, the ones that meet the needs. So thank you.
Corinne, can I just say in the chat, I see a comment that says, I hope Boulder County demonstrates a willingness to listening to industry specific feedback. And I just want to emphasize, we are listening. We all see this chat. We pass along all of that information up to the decision makers. It's all taken into account. I really appreciate folks putting these questions in the chat. We look at it, we consider it. Please do continue providing that feedback.
And the questions that you submit to me or to Tessa or to Trina or to any of the staff, when those are taken, they took those into consideration when creating the Fully Vaccinated Facility program. In fact, some of the questions to the mask order were the impetus to creating the program to start out with. So I do want to say that I've seen a lot, changing the frequently asked questions to understand, looking at industry specific concerns. I do want to continue to see this as a partnership between industry and all of us, at the table together as we together get this disease under control and try to get back to normal. As Trina said, our goal is to get back to normal, get back to our normal lives. So thank you. See you Thursday.